San Diego's hospitals aren't nearly as crowded as they were just a couple of months ago as we head back into the red tier. The number of patients with COVID-19 in the ICU is down greatly. News 8's Brandon Lewis explains why medical staff are breathing a sigh of relief, but also closely watching new cases.
Carlo and Marcella, it's been a long winter for the hospital staff, not only here at UC San Diego, but at hospitals all across the county. Many of them tell us they are now at pre-pandemic levels, but there are still hundreds of people who are in the hospital with COVID-19. And doctors say they are also keeping their eyes open for any potential new variants.
I mean, it has been a year like none other.
Hospital staff are finally getting a breather. Hospitalizations are down more than 80% from their January peak, and the share of ICU patients with coronavirus went from a large majority to around 1 in 5.
I think now that there's a little bit more breathing room, I think people are really thinking about and processing what the pandemic has meant to them and their families in a way that they haven't really had time to do up until now.
The decline is attributable to several factors, including the stay-at-home order and doctors just getting better at treating it, along with, of course, vaccinating those most at risk of coronavirus's worst symptoms.
Getting those folks vaccinated early on in top tier, helps me sleep better at night, knowing that the risk of an epidemic in a nursing home and the number of people ending up in the ICU, dying from COVID has really been reduced substantially for that.
But not everyone is home free. Hundreds of people are still in the hospital, including younger people who are near the back of the line for the vaccine.
When we admit patients in their 20s and 30s, they can be very ill, and sometimes it's a shock to them that they kind of feel they're not supposed to be that sick.
Still, there is optimism in the air that we may have finally passed the peak. Plus, there's a sense of accomplishment that we've come so far relatively so quickly.
I think, we've seen what we can do and we need to in terms of needing to flex up. I think, we know at this point if we have to do it, we're not going to run out of equipment. We're not going to run out of staff. It's going to be a lot of hard work, but we're used to hard work and we can do whatever our community needs us to do.
Some of those younger people he mentioned are in the hospital because they had pre-existing conditions. As a reminder, some of them became eligible to get the vaccine on Monday. Carlo and Marcella.